Good morning, everybody. It's Dr. Blood here. Hey, this morning's topic is, can chiropractic help migraines? So, for me, I always take an outside of the box approach to migraines because headaches can be tricky in that there's multiple different types of headaches and there's overlap in symptomatology. So, yes, there are true migraines, but there's also headaches that can mimic migraines. And typically the way I look at it is if someone has a true migraine onset, then but usually by the time they get to someone like me is they've already tried, they've already had the scans, they've already had some type of migraine medication management like a Topamax. And I look at it, if it's a true migraine, like the migraine medications typically will have a decent result. Now, if it's something else that's mimicking a migraine, like a cervicogenic type headache or even a tension type headache that has an origination from the neck or the shoulders or trigger points in the suboccipital musculature or trigger points in the SCM right here, that'll just come up and go right to the eye. All of those types of things, those are the types of headaches that we treat successfully in an integrated clinic like ours, where we can have a medical approach, we can have a chiropractic approach, we can have a soft tissue approach, and we can have a rehabilitation approach. So ultimately, yes. Now, if it is a true migraine and there's not much or any contributor from the neck tissues or anything like that, then we switch to more of a nutritional approach. And we talked a little bit about this yesterday, is on the nutritional side, we want to avoid inflammatory foods. So we want to avoid basically the good stuff, the grains, the processed stuff, the sugars, the flours, and we want to stick to lean meats, preferably grass-fed. We want to stick to fresh fruits and vegetables, fruits in moderation. And we can consume raw nuts. We can supplement with omega-3 fatty acids and avoid the omega-6 fatty acids. One other hack with migraines is supplementing. There's 3 good supplements to consider if you have true migraines. One is magnesium. Magnesium, the standard dosage is about 400 milligrams a day. The next supplement to consider is CoQ10, coenzyme Q10, or ubiquinol. Those are the recommended doses is, for migraines, I usually go to 200 milligrams a day. 100 milligrams a day is a pretty standard dose. And then the last one for migraines is riboflavin, which is a B vitamin. And so normally I just recommend a B complex because not too many companies make a specific riboflavin supplement. It's funny because I used to recommend that to patients, then they'd go get an opinion from the Cleveland Clinic, and the Cleveland Clinic head of neurology at the time told the patient the same thing: coenzyme Q10, magnesium, and riboflavin. So that's kind of on the supplement side. So hope that answers the question in terms of chiropractic and migraine headaches. Yes, we have a lot of success with it, and it just comes down to our examination and how we approach and figure out what the triggers are and how do we treat that and restore function through the neck, head, and shoulders. So have a great day, have a healthy day, and we'll see you tomorrow.